Welcome to our fifth Friday Corona Corner chat. I hope that you're all at home and safe and healthy. You know, students, I realize that we're on the home stretch with respect to the semester. And I know that you're probably preparing now for your final exams and your final papers. And I realize that this is probably a stressful time period for you and that there's probably quite a bit of anxiety. I don't want you to feel alone or particularly stressed by this period. I recognize that this has been a very unusual semester for you and that it has probably been particularly difficult. Please know that we have incredible counselors and academic advisors that are here to help you, and you don't need to struggle alone if you're having a difficult time. So please avail yourselves of the wonderful support that we have here at Oakland University. That's one of the things that we're particularly proud of. And I again want to applaud all of our students and our faculty for how adaptable and entrepreneurial and how really incredible you've been this semester, for how well you've adjusted to the remarkable changes that we've had to make in the remote learning environment. You've really done this in a remarkable way. The COVID-19 virus, which has upended every aspect of our lives, has really transformed life as we know it. Today, there have been more than 1.5 million infections globally. And here in Michigan, as of today, there are at least more than 20,000 people who have become infected and more than 1,000 deaths. And so since the majority of those are right here in Southeast Michigan, it's no surprise that members of our own Oakland University community have been impacted. And so that I now know that there are students and faculty and staff members who have actually either have members of their own individual families or loved ones who have become infected themselves or have family members who are hospitalized or home now sick with the virus, and our hearts go out to you. I have to actually share, some of you are aware that I have 3 children and 3 in-law children and 5 grandchildren, and 2 of my children are actually home sick right now, recovering from the COVID-19 infection. One of my children and a daughter-in-law who are frontline healthcare providers became infected this week and are home now recovering. So I know firsthand how difficult this is for those of you who may be on the front lines. We know that here in Southeast Michigan now thousands of healthcare providers have become infected, and as we talked last week, they are heroes for taking care of patients and putting themselves and their families at risk. And so we applaud their efforts. And as we have been talking, so many members of our Oakland University community have done so much and so selflessly to help support others. We talked about our team, the Engagement and Mobilization Task Force that is doing yeoman's work to support our local community. And this week I just want to share with you a few examples of some of the tremendous work that is happening just right here at Oakland University. So this week I'm just going to share a few examples, and I want to highlight the work of the Oakland University William Beaumont School of Medicine. And I'm so proud that our medical school created a novel course. They have developed a course for COVID-19, which is unique in the country. Our medical students are also now participating in helping to develop and design clinical trials, which are both involved in the diagnosis and treatment for new therapies for COVID-19, which will really transform both how we diagnose and treat the disease, which will make a huge difference in bringing an end to this plague that is really so adversely impacting us. And our medical students are also very actively participating in supporting patient care, food distribution, tutoring, and many other things. Other members of our great volunteer teams are doing lots of other things, like, again, supporting food distribution. We have a mighty team of volunteers who are sewing masks. And again, I want to remind you that while we want you to stay at home, if you do go out in public, please wear a mask. And if you're one of our volunteers who is helping us to sew masks, we are very happy to accept your masks here at the Oakland Center. You may drop those off on Friday afternoons between 1 and 3 p.m., and we will help distribute those to others who need those. We left you some instructions on how you can make those masks, and you can drop those off. I've also become aware that our community is in great need of a few additional things that you can also drop off at the Oakland Center from 1 to 3 p.m. on Fridays. And that includes disposable diapers, wipes for babies, and formula. And we have a great need for that as well, and you may drop that off. As you know, because we have talked about this, our own community is also in need, and we created a COVID-19 relief fund for students, and we told you about that in the past. But now we have also become aware that staff and faculty, as well as our greater community, also have become needy, and our relief fund extends to all of them as well. So if you find yourself in need, please visit our website and apply, and there are some funds now available. And we want to be there to help our broader community. So please let us know what you need, and we will do our best to make funds available. And now I really want to thank our generous community. We have had hundreds of people provide us with philanthropic support for our relief fund, and the power of this support is so extraordinary. So thank you if you have been one of our donors. We're still accepting gifts too, so if you're able to provide us with support, we thank you very much from the bottom of our hearts. You know, compassion is a very interesting phenomenon. It's a combination of empathy, which is the ability to put yourself in another person's shoes and feel what they might feel. But it's not just that alone. It's that feeling, but coupled with action. And that, in my mind, is what's so unique about our Oakland University community. We don't just feel what other people feel. We feel what they feel, and then we act on it. And in my mind, that is what's so remarkable about Oakland University. Last week, I got a great note from one of my sisters-in-law, and I thought I would share that with you today. And here's what she told me. She wanted to share her diary with me, and she called it her self-isolation quarantine diary. And she said on day 1, she was examining her strawberries. She said, Ora, some of them have 210 seeds, and some of them have 235 seeds. Who knew? On day 2 at 8 p.m., I removed my day pajamas and I put on my night pajamas. Oh my goodness. On day 3, I tried to make hand sanitizer, but it came out as Jell-O shots. On day 4, I got to take out my garbage, but I was so excited I couldn't decide what to wear. On day 5, I was laughing way too much at my own jokes. On day 6, I went to a new restaurant called The Kitchen. You have to gather all the ingredients and make your own meal. And I have no clue how this place is still in business. On day 7, I struck up a conversation with a spider. He seems nice. He's a web designer. On day 8, I discovered that isolation was hard. I swear my refrigerator just said, "What the heck do you want now?" On day 9, I realized why dogs get so excited about something moving outside, going for walks, or riding in cars. And I think I just barked at a squirrel. On day 10, I watched the birds fight over a worm. The Cardinals lead the Blue Jays 3-1. On day 11, does anybody else feel like they've cooked dinner about 365 times this month alone? Well, that's what my sister-in-law said, that being at home for such a short time feels like. Well, I know that it's been rough being at home so much, but you know, today is Good Friday, and this Sunday is Easter, and spring is here. And I just want to say that I think we have the most amazing community. And with spring being here, I think this is the season of hope, renewal, and new life. And I do see a lot of hope on the horizon. So I just want to thank our fantastic community for being so wonderful. And I want to applaud you for following our instructions so well. And I know I'll be seeing you again next Friday at our next Corona Corner chat. See you then.